Hi, today we are going to discuss radiofrequency ablation of spine or medial branches of lumbar spine or cervical spine, as the case may be. First, let's talk about what procedure we are doing. We are trying to denervate or cut the nerve supply to the small joints in the back, which are called Z-joint or zygapophyseal joints or facet joints. And they are present in a pair at each spinal level until the lumbosacral junction all the way from the neck. And that joint, when it's arthritic, can cause significant axial back or axial neck pain, which can be a big contributor of morbidity. First thing to look at is who is a good candidate for this procedure. Essentially, this is a good treatment option for axial back or axial neck pain, which is made worse by extension or straightening of the spine. So people could be having pain which is worse with standing or walking, typically relieved by sitting to some degree, but sometimes even twisting or bending can also make this pain worse. And most of the pain is limited to the lower lumbar region, but occasionally it could go to the butt or gluteal region or to the back of the head in the case of neck. So if you have any of these symptoms, you could be a good candidate. The good thing about this procedure is that it's not a surgery. There's no cuts or no incisions placed. It's all done through needle, and it's a pretty safe procedure, being done for more than last 3 decades. Although the first time it was done was somewhere in 1975. But since then, many people have done this, and there's hardly much complications. We'll come to the complication part later. And next benefit is that it's covered by most insurances. So first, let's understand a little bit more about the procedure itself. So like we discussed, you can see the spine, which consists of lumbar or cervical vertebrae, which has a front vertebral body. There's a spinal canal through which the spinal cord and the nerve roots run, and there's the spine which you are able to feel with your finger in the back. And then there are a pair of small joints. They're called the Z joints or facet joints. And this picture shows it a little more in detail. You can see each of the facet joint is supplied by 2 small branches from the main nerve root, and they're called the medial branches. And they take pain signal of whatever sensation from these joints. So if you're able to target this small joint, small nerve, and inactivate it, then you could get pain relief from arthritic pain from the small joints. And that's the philosophy behind this treatment option. So we are able to place needle, which are, I'll show you one here. So when we do the medial branch block, or the first step, we use a smaller needle than this, but this is a radiofrequency ablation needle itself, and you can see it's also a tiny needle. You're able to place it to the junction of the transverse process and the superior articulating facet. And if we are able to put some small amount of numbing medication, we are able to inactivate that nerve for a brief period, and that will be a positive or a good test. And if you have 2 such tests, then you qualify for radiofrequency ablation. So this is essentially a 3-step procedure. The first 2 steps are only a nerve block, where we use tiny needle to place small amount of numbing medication or local anesthetic at the junction of superior articulating facet and transverse process. That's this junction here. And you can see it's a very tiny needle. It only need to go in about 2.5–3 inch deep. We are not even entering the spinal canal. It's a pretty safe procedure. And we place 3 needles on each side, and we deliver a small amount of numbing medication. And essentially we numb up 2 joints and see if that takes away the pain. And when we do the medial branch block, we use X-ray machine. You can see to the right, we use a fluoroscope, and that helps us to accurately place the needle to the correct location without any injury to the spinal cord or the nerve root. And it takes about 10 minutes. It's a pretty simple procedure. And what's important is, after the procedure, make sure you write down the pain and how much activities you are able to do for the next few hours at least. And that will give us an idea of how much relief you got from this nerve block or medial branch block. Once you have had 2 successful medial branch block, the next step is radiofrequency ablation itself. And we do that with this radiofrequency needle, and we use Stryker radiofrequency machine. That's a Next Gen 2. That's the latest machine. We use again X-ray machine to guide the needle to the accurate needle positioning, targeting the medial branches. We test the positioning with more electrode cables, and the electrodes are placed through the cannula itself. There's no skin cut, it's only needle puncture. And then we are able to test for sensory and motor to make sure we are placing the radiofrequency probes in the right place. And subsequently, we deepen the anesthesia once the testing is done. So altogether, it's a little more lengthier procedure. It can take about 35–40 minutes, depending on how long it takes to get the IV, things like that. After that, we do radiofrequency ablation, which essentially is heating the medial branches to about 80 degrees. It's not really charring or anything. It's only heating to make the nerve not work. And the nerve will grow back, and that's a good thing and bad thing about it. So it's not a permanent treatment, but it lasts about 6 months to 14 months. It's pretty good duration of relief. And if it gives you a good relief, it can always be repeated after 6 months. And most insurance approve repeating the radiofrequency ablation after 6 months. And you don't need to go through 3 steps at that point. You already proved to the insurance that you are at the right location by having a first radiofrequency burn. So you just need to repeat the 3rd step. So once the procedure is done, it almost helps almost immediately for most people. Sometimes it takes few weeks for the heating and inflammation to subside. So some people might feel that it didn't work for the first couple of weeks before it really kicks in. And it works in about 80% of the time, and that's a pretty decent number when you look at low back pain and the treatment options that are available. Next step is preparing for the procedure itself. Make sure you come fasting. You can take sips of water up to a couple of hours before the procedure, but avoid anything heavy for at least 6 to 8 hours before the procedure, since we use moderate sedation. If you take any kind of blood thinner, definitely talk to the provider. It's not a high risk procedure. It's considered an intermediate risk procedure since we are not going into the spinal canal. Still, if you're not taking blood thinner for anything really that significant, it's better to come off the blood thinner for a prescribed. You can talk to the provider and they will give you the exact number of dates. And that way you can avoid the chance of having a bruise or beat up appearance in the lumbar spine, which is again pretty rare. Next question that people sometimes ask is that if I have already had a surgery, will that be an issue? So if you had a previous surgery like fusion at L4-5, then you're not a candidate for radiofrequency ablation at that level, but we could still treat the level above and below. So if it's a procedure like partial discectomy, it's not a problem. We can still treat the same level. Next, I would like to touch upon the complications or side effects. As I said before, it's a pretty safe procedure, and the common side effects that you see are sometimes a flare-up of pain. Mind that we are heating nerve tissue, so sometimes you may find a little bit of worsening of pain for a few days, and sometimes it might take a few weeks before the relief kicks in. The other rare side effects include infection, bleeding, nerve injury, which are all again very rare. The procedure has been done for more than 30 years, and I've been doing it since 2015 and seen people, including me or other colleagues of mine, running into any problems. The older generation machines used to occasionally give a skin burn where we put the grounding pad. Now, the newer generations don't do that anymore. So overall, it's a pretty safe procedure.